medical expert that we've been leaning on for weeks now, and we cannot thank him enough for taking time out of his busy schedule and spending some time with us. And we're talking about from Mercy Health, our good friend Dr. Dennis Norem, who's on the line with us this morning. Dr. Norem, good morning to you.
Good morning to you guys. How are you doing?
We're doing very well. How are things with you this morning?
Oh, I'm surviving. It's a little nippy out there. They're hoping for a little more spring.
Yeah, that would be nice. But then again, if you're going to keep yourself, cloistered in the house, you might as well have it, all that great outside.
That's true. It keeps us appreciative of the fact we need to stay in.
It does. Last week when we talked, when we left off, you had brought up one of the things up for discussion this week would be, why is it that COVID-19 seems to, cause men to fare worse than women?
That is a very interesting question. I was looking at some of the statistics. In China, they said about 64% of the deaths are in men. In Italy, it's about 71%. And here in the United States, it's at least 60%. One of the thoughts, or a couple of the thoughts are, as I've seen this over the years with my own patients, men tend to be less likely to get treatment. You know how we are. My wife has always said, without women, we'd be savages. But
and she's right.
But we tend not to go to the physicians or see our physicians. There's some studies that show we're less likely to watch our hygiene, wash our hands. We have higher rates of smoking, alcohol, drug use. But the other interesting factor is there's good evidence over the years that women produce a better immune response to viruses than men. It may be estrogen related, it may be some other factors, but clearly women have a little better protection against viruses.
Well, I looked at the unhealthy habits thing because I did a little background on this one myself, and that was the one that keeps jumping out the most, it seems, when people are trying to figure out why this might be. Our unhealthy bits of habit, as you mentioned, less quick to do hand washing and hygiene. We smoke more, we drink more, we're heavier, other unhealthy behaviors.
Yeah, absolutely. But I found that other factor, that women may actually have better protection. And over the years, the thought is that this is a advantage in terms of protecting during pregnancy, protecting the ability to take care of children. So, a very interesting factor.
So it looks more societal kind of factors, not necessarily women are programmed better to fight this than men, right?
It's hard to say. It's probably both, but I suspect if us men were better taking care of ourselves and reducing our smoking rates, alcohol, and washing our hands, we would have a much closer ratio between the men and the women.
I got to figure that when all this is said and done, and at some point it will be, the fact that hand washing is a huge, huge part of a human being's day is something that's going to stick around with us for quite a long while.
I think you're absolutely right. It really has increased the awareness of how important it is for this infection. But as you guys know, we've been hearing this ever since we were old enough to listen. I can remember my folks or my mother telling me to wash my hands. As part of being educated as a physician, hygiene is extremely important. I remember talking about a study years ago, a pre-surgical study about surgical infections, and somebody did a study and showed that just simply washing the area with soap and water was just as effective as using more sophisticated antiseptics.
It all makes perfect sense because being the son and grandson of people who went through the Depression, you looked at some of the marks that made ever after on bits of behavior. One that jumps out at me right off the bat is clean plate. Clean plate, clean plate. We didn't know if we're going to get food tomorrow. We didn't know if there's going to be enough. So it was a clean plate thing that kind of stuck with them forever. Well, we're having wash your hands and hygiene and all that pounded into our skulls so thoroughly that I think after this, everybody who comes through on the other side will have that mark hanging around them forever.
And hopefully, it'll be interesting to see in the future if other viral infections, obviously our flu seasons, if we can get people to be more conscious about these types of things we're doing now, will we have less of those kinds of outbreaks in the future.
Doc, testing is something that's we always talk about here. How we doing testing wise? Both testing if you have COVID right now, and the antibodies test that everyone's talking about, hopefully coming up later. Good progress? Are we getting to anywhere close to where we need to be?
We're not where we need to be. As far as testing for active infection, it's certainly improving. I've noticed the turnaround time. I've tested a few people. As you guys know, I work a little bit part-time, and I've been doing a little bit of testing, and that turnaround time has improved significantly. I think I'm getting testing back in 2 to 3 days for the acute infection. So that's improving, at least here in Rockford.
And that's, real quick, that's still with the nasal swab test, correct?
Correct. That's the nasal swab. That's the test to see if you have coronavirus now. But what's really important is we would like to be able to test to see if you have had it. That's the antibody test. So that's a blood test. You have to get blood drawn for that. There's also apparently a finger prick version of that that's available, at least in Europe. And my understanding that was just approved last week to become available. So it's not readily available. I hear maybe in the next 2 to 3 weeks we'll have that availability from the reference labs to be able to test people to see if they have the antibodies.
You mentioned the antibodies test is a blood test. Is that consistent for all antibodies tests? It's the only way we figured out for antibodies is to do blood, or I mean, can we do something else to find out if you had the flu?
As far as I know, almost all antibody tests have to be blood currently. I don't think you can get antibodies off of different fluids, but they probably are not all that helpful. For instance, actually, you can get antibodies in the urine for certain types of pneumonia, but for generally speaking, you have to get blood.
And when the widespread antibodies testing goes into play, and you find that more and more people are having that test done, that will give us a better look at the thing we talked about, 2 or 3 weeks ago, the Oxford professor who's got the hypothesis that this may have raged through a lot sooner than we thought it did, and some people had it and have gone on and have developed antibodies to it afterwards, and that'd be one way of finding out if that's true, right?
Yes, it would be very helpful because there is some debate now that the cases in New York, that virus is probably there much sooner than we thought and may have actually traveled through Europe, not directly from China. So there's some, questions about where did it start and how did it get here, and it may help us answer some of those questions.
We've seen both sides of this stupidly political discussion talk about death rate, and one side will say that we're overestimating the death rate because if you catch it and you die from something else, they're calling it COVID. The other side will say we're barely testing, so obviously people passing away that's never had the test, we're under-reporting deaths from this. Which one is it? It's obviously in the middle somewhere, but which way would you say we're leaning towards right now?
I think we're probably leaning towards a little bit of underreporting. A statistic came out of New York, which I thought was interesting. In the past, they generally would have 25 people die at home a day from various causes. Currently, they have 250, and they haven't had the ability to test all of those people. So I think you're going to see in these hotspot areas in major cities where they have people dying at home, a lot of those are going to get underreported. On the other hand, people argue that we overreport because anybody that has COVID-19 and dies of anything, that's reported as a COVID-19 death. So I suspect we're still underreported. As we get better testing, we'll probably be able to get a pretty good idea who has it and who doesn't, especially if we can get the antibody testing.
Dr. Norem, we were talking earlier this morning about Sweden's approach to dealing with this COVID-19 crisis being a little bit different than many other countries are doing, showing some mixed results. They're still gonna ride out the course that they're on, at least for the time being. Denmark, one of the first countries right across that strip of sea that shut itself down, now is talking about a gradual starting to reopen. Well, what's your take on what Sweden's doing and overall about places that are talking about how can we get things to reopen?
Well, I think it's interesting because, from what I understand, Sweden wasn't nearly as aggressive about shutting their country down and the distancing and all of that. And apparently their numbers look okay compared to other places that have been more aggressive like us. On the other hand, Sweden's a homogeneous population. It's mostly Swedes. It's not nearly as dense. It's more like our rural populations in this country, although it has some major cities, it doesn't have the density. And, there may be differences in terms of infectivity amongst different groups of people. In other words, possibly the Swedes are a little less prone to this infection. So it is hard to compare us to Swedes, but I think I look at Sweden as more of some of our states that are a little less dense and people are a little more spread out. And you'd probably have to start looking, too, at their personal habits. Are they better at washing their hands? Are they better at lower rates of smoking, alcohol, drugs, those kinds of things that may help them in terms of less infectivity? But it'll be interesting to see how they do as they do open up the country, and maybe that will allow us some lessons in how we can kind of open up parts of our country at least.
Dr. Fauci made some news the other day when he said that handshaking might be thing of the past, and that's part of our social fabric.
And it was his opinion it should be a thing of the past too.
It should be the thing of the past. Obviously, if we stop shaking hands, it would help. It's definitely not going to hurt anything. As a medical professional yourself, is that something you would like to see going to happen, or is it maybe not worth changing our societal fabric and figuring out something else to do?
I think it's going to be very difficult to eliminate that from society. However, I think in the future, when there is any kind of potential pandemic, flu outbreak, whatever, I think people are going to be much more willing to suspend this custom. But I'm not sure as a society we're going to eliminate handshaking. I mean, the elbow bumping is okay, but it's just not the same thing.
Agreed.
It's true. It is not the same thing. What about potential vaccines? They're talking about let's try to get Major League Baseball back together. Let's get them out in Arizona. Let's get everybody doing their thing. But if something goes wrong out there, then you've got a whole bunch of teams who are all part of an incubator all over again. What kind of time span are we talking about? Let's say there was a breakthrough in a lab today where they went, this thing that we're applying wipes it out. How long before something like that would be widely available?
I think that's a very difficult question to answer. If you're talking about vaccines, which there, I think, are several different studies currently going, but I think the best scenario is 8 months to a year. If there were medication breakthrough, I mean, there are studies of, I think, last time I looked, there's at least 10 different things they're studying, including a couple different antivirals, the hydroxychloroquine, which unfortunately one of the studies that I just saw recently didn't really show a whole lot of benefit, unless it was something, even if it was something breakthrough that was very effective. In order to get that manufactured and on the market is probably 9 months to a year at best. So it's still going to take some time. Hopefully they'll find something that's currently available that works a little bit better, and they're certainly trying several different things with some of these patients.
Doc, 2 weeks ago, the phrase you could not get away from was flattening the curve. I haven't heard it in about a week from anybody. Have we flattened the curve? Are we so concerned about that?
I think there's suggestions in New York and a couple of the hot spots areas, I think up in Washington, that they're starting to see a trend of flattening. As you guys know with statistics, you need to have several different data points before you can say something's really trending one way or the other. But there's some suggestion, and I think the best statistic that suggests this is the fact that in New York, they're seeing increasing death rate, but decreasing hospitalization rates and slightly decreasing rates of ICU admissions. It takes, the average person that ends up in ICU on a ventilator spends somewhere between 6 days to 2 weeks on a ventilator. So there's almost a 2-week time lag between those two factors, between the death rate and the admission rate. So that suggests that we're heading towards flattening the curve, but time will tell.
Dr. Norem, before we let you go this morning, anything to impart, any advice to give out to people who are having a time with this? We talk about the physical aspects of this. What happens? Your temperature goes up, body aches, you're going to get this, ventilation and all that. But one of the things that is being touched on, but not nearly to the same degree, is what it's doing to people mentally.
Yeah, you bring up an excellent point. There are resources on the internet to try to help people with the mental aspects. And I think the one thing that can help and people should try to do is communicate with your friends. Call them on the phone. If you have a computer, you can do Zoom or you can do Skype or whatever. There's a tendency when you're sitting around staring against the walls to say, to hell with it, I'm just going to hunker down and I'm not going to talk to anybody. But I would say try to communicate. Maybe call up an old friend you haven't heard from in a while. Ask them how they're doing.
Not a bad idea. Yeah, not a bad idea. I've seen my son do that with a bunch of his college friends, getting together for their impromptu nighttime computer chats. I know, Joe, you guys did it over the weekend as well.
Yeah, lots of beer.
Lots of beer, which I believe would be Dr. Norm's next recommendation right after that. Just call your friend, see how it's doing. Lots of beer.
Well, I recommend it. For men, at least 2 beers. You can have at least 2 beers. Now, beyond that, Joe, I get a little concerned, but no.
Well, I stock up. I stock up throughout the week, and I save them all for Friday night.
Okay, fair enough.
That checks out, right?
Yeah. For people wondering what forced the doctor into retirement, there it is. Patients like that. Dr. Norem, as always, we appreciate the time, the expertise. If you're available next Monday to continue our rundown of how things are going, we would be delighted to hear from you.
I will certainly touch base with you next week, guys.
Outstanding. Thank you very much for your time.